Hello. This is Chris with Executive Health Solutions, Physical Therapy, Chiropractic Services, and
And I'm Brooke.
same place.
Yeah,
EHS,
same
Physical Therapy.
place.
Okay. All right. So a common question that we get, and a common question that you have, people, it's fine because it's goes both ways, and no one really knows, and it's hard to determine. You're having pain, a lot of pain. It's in your back, it's in your neck, it's in your elbow, it's wherever it is. Which do you use, hot or cold? I mean, it's two choices. But they're very. There's camps on both sides. There's research from the past. There's new research that says yes, this one, and then all of a sudden we'll say no, switch back to the other. So which one do you use? Let's go, Brooke. In your opinion, have you found one to be more beneficial than another, or advice that you would give someone to say, I hurt myself, what should I use, hot or cold?
So usually I tell people to try and use ice first, especially for an acute injury, because it helps calm everything down a little bit more than heat, in my opinion. So if you have say you get hurt right now, I would say go put some ice on it, because you're just gonna kind of calm all of that inflammation down. And if you use heat for that, it can increase the inflammatory mediators and all of those things that are coming to the site to repair the tissue. And sometimes it can make it worse, but it also depends too. Sometimes people respond better to heat than they do ice in those the acute injuries. So my always go to is ice first. If ice doesn't help, then you can try heat afterwards. But it's also very patient specific. Sometimes people do respond to heat better than ice.
Yeah, I mean, I feel the same way. I'm on the same road with that. In general, now again, there's different research out that things are still coming around and changing this. Mm-hmm. But in general, ice tends to be. Now we're talking. So let's back up a second. Right away, meaning acute, it just happened. Within the say 24 hours for when we talk about inflammation, that is a natural part of the healing process. You don't necessarily want that to be gone. I mean, you need part of that as it comes in, and it helps, eat away little macrophages, kind of eat away some of the damage to the tissue. There's an increase in the blood flow. There's some bleeding. Basically, say you sprain an ankle, that's classic. You get some tearing. There's some bleeding. There's some joint, what we call effusion. So the inflammatory process is actually a necessary process. What we're talking about is trying to lessen some of the adverse symptoms of the inflammatory process. So to calm down some of the pain and help reduce some of that. Ice tends to be a pretty good, not universal, but a pretty good modality for that. Now, as things change with research and yes, ice, no ice, yes, heat, no heat, I do feel it comes down to, at a point, to a little bit of a personal preference for some. Yeah. I like ice. I feel like it helps me do very well with soreness or injury, or that's what I would choose first. Some people I know, though, say no, that does not help. Makes me feel worse, and heat feels better. Mm-hmm. So we're going more off the physiology of what we learned, in school. But there's also a part about just clinical, experience and getting to know people and what's worked best for them. But I would err on the side too if it just happened, try ice first.
Yep.
If you're talking this pain has been going on for weeks, and you're just like, oh, today it's just really I'm really sore. You could do either.
Yeah, you could do either. Even then, if it's been a chronic, it's been happening for months, heat might be your best option because it can increase all of the inflammation, the inflammatory
blood flow,
everything. So heat might be a better option in that case.
In certain things like tendons, injured tendons, maladapted tendons, they tend to feel better when they're warmed up.
Right.
When you first, I show you first throw, oh, that hurts. But then as you kind of keep going, it kind of calms down, or it gets better as you keep going. So then heat would be a good thing at the start, maybe. Mm-hmm. And then if it's really sore or maybe irritated after a workout or doing things, then I guess I would go back to ice again. Yeah.
Right.
But it's always a controversy. It's always a question.
Yeah.
You're going to have to experiment a little bit with what your body feels better with. Mm-hmm. But we would say initial acute, meaning just happened 24 hours, 10 hours, like, you just did it. Shoot, 10 minutes.
Yeah.
10 minutes, you just bring,
Yeah,
you
like
know.
within like the first like 48 to 72 hours
Yeah,
kind of thing.
I would try ice first, but really see how it feels with your body, how you respond to it, how you feel afterwards. I mean, like most of the time, what I like about ice too is it has that analgesic effect of kind of numbing. Yeah, it kind of hurts initially when you put it on because it's cold. But then after you take it off, you're like, yeah, that kind of feels better because it's kind of numb.
Yeah.
Which helps. Like, it doesn't hurt as bad.
Yeah, that's another thing. Make sure you keep it on long enough too. So it should go through a couple different stages. So initially it's just going to feel cold, and then it's going to feel like a little bit of like a burning from the cold, and then eventually you get to the numbness stage, and that's when you take it off.
Yeah.
So you can't just specifically go by time. Like some people are like, oh, like 10 minutes, 20 minutes, 15 minutes. How long do I keep it on? You really got to go by how you feel. Like once it feels numb and you can't feel anything anymore, that's when you take it off.
Yeah. It actually gives a good analgesic or pain relieving property of ice but if you have to leave it on there long enough to actually get through those, and that's the hardest part is that people want to take it off when it's in that burning stage and it's like, oh, this hurts because it's so cold. But just if you can
keep it on there.
Bite down on a stick or something, just get through that part of it.
Distract yourself somehow, watch Netflix or something.
Yeah, and then it usually does feel pretty good afterwards. But still think about after, like, okay, for some reason, if someone has a sensitivity to cold, and they get so stiff afterwards, or they get a bunch of maybe redness to the skin. There'll be some redness, but I mean like inappropriate. Like it's bad, and they have it's rare, but people do have some sensitivities to cold. Then maybe you want to do go to heat. But in the vast majority of cases, when erroring, if you err on the side of of caution or not sure. When it just happened, we would say ice first, then heat.
Yep.
If it's been a long time, we would probably switch that and say heat first, then ice. Yeah, because even when you warm up, I mean that's pretty well known now that we don't just statically stretch things like like how you used to just hold. Okay, 1, 2, 3. You have to dynamically warm up your muscles through jumping and running and jogging. That's because the heat and friction created from your muscles moving helps loosen up those tissues and prepare you for movement, which would be good in the sense of heat first and then after you're done, ice after for later conditions. So, okay. I think that's good advice. Thanks.